As we say, Hail Mary, full of grace.
This is like my experience. I was born in this community and I experienced firsthand how people could not access medical care. I had experiences of friends and close relatives, even priests dying because of the lack of medical care. So I told myself I am going to try to make a difference in whichever way that I can. So that was how almost 11 years ago now, I was able to put together a team of medical practitioners so that this has become an annual event where we provide care, to as many people as possible. So that was my inspiration to make sure that I change that situation which I found to be not suitable, not exactly what the people needed. So I tried to become that change in their favor.
My name is Dr. Phil Perino. I am here from the US and I am an optometrist and will be providing eye care.
My name is Ruth Howard and I'm a nurse from the United States, and I've accompanied Father Kingsley here for his medical mission. I knew him as a priest in our parish back in the States, and he's so inspirational, and I wanted to come with him to help our folks here.
The thing that keeps me coming back, really, is my commitment as a Catholic to serving the poor and the needy. The last thing, or one of the last things Jesus said was to love one another. And so this is a way that I can take the skill set and the education that I've been blessed with and share it among, not only the people in my country, but with his children here in Obike.
The passport clinic we went to, I think they were a little misinformed, and they made me think that I could get sick if I came here. However, I don't believe that's true. I got the vaccinations and I've taken the medications they wanted me to take, and I think this is a very safe place to come as far as my health goes. So it was a pleasant surprise, and I would come again.
I must say that I'm glad to be here, because if I should go to the hospital to pay for all of this, I know how much it would cost me.
I am extremely, tremendously overjoyed and happy.
Since yesterday, wow, it was awesome. Mothers are getting healed, children, fathers are getting healed. Look at me, general body test, free.
I came to thank Father Kingsley. Since I lost my parents, he has been the one sponsoring my education.
We have the qualified type of medical practitioners, including doctors, nurses, pharmacists. For instance, we have a pharmacist here with over 17 years experience, and so are our nurses. So the quality of the people providing the care is something that we prioritize. But much more than that, we make sure that the medication they receive have also the necessary quality. In fact, as a matter of fact, I have to ship some of them from overseas, but also we have to purchase some of them locally, making sure that what they receive is what they deserve.
My name is Dr. Miracle Chimdi. I'm here at Divine Mercy Medical Center Ngor-okpala for the medical outreach, the annual medical outreach. I met this young man, and his only complaint was a swelling on the eye that's been there for years. Based on history and assessment, we got the impression it was a lipoma, and we did an excision. It lasted about 20 minutes, 25 minutes tops. And now he's on antibiotics to prevent infection, and he's good to go.
We, their brothers, we are overjoyed. Beside ourselves with joy, because we don't know how to explain the magnitude of the extent of which they have helped humanity in this form.
I also hope to integrate surgeons into the clinic so that we can provide care for people who need surgery, which would be mostly for cataract and for glaucoma. Two conditions that can lead to blindness, and we see I've seen enough people here that have those conditions that need to be taken care of, sometimes just with drops or medications, but other times they need surgery to see again.
A thing of beauty is joy forever, John Keys says. This is a thing of beauty and it's such joy. So I am grateful to you. I'm grateful to the security men who are here helping us. I'm grateful to our hospital staff, grateful to our doctors and nurses and volunteers. I'm especially extremely grateful to my friends in the United States, from Massachusetts to Connecticut to New Jersey to Texas to Pennsylvania to Maryland to Washington State to California. It's all across the United States. You have lots of people of goodwill helping to make this real. So I am very grateful to them, but also I am grateful to the board of the Divine Mercy International Widows and Orphans Organization. Without them, none of this will be possible. So I am extremely grateful to them and everyone who is helping to make this possible.